Very good morning to all of you viewers of NK's Lockdown Musings. This is a very special episode in which I will be talking to the District Collector of Kasargod District. It's the neighboring district of Dakshina Kannada and therefore very important to all of us. We have a lot of ties with them and they have the same problems probably that we have in Dakshina Kannada with regard to COVID-19. In fact, our two states, Karnataka and Kerala, also are on similar footing as far as the COVID-19 is concerned. Approximately 400 cases and the morbidity rate in Kerala is much less than the national average, much less than the world average. The national average is around 3%, the world average is around 6%. And the Kerala morbidity rate, I think there's just 3 deaths and it's probably around 0.6%. And they have been able to contain the COVID-19 crisis remarkably well, and it's been documented in many newspapers around the world. I just wanted to ask the District Collector of Kasargod, let me introduce him first, about what Kerala has done differently, but let me introduce him first. Dr. Sajith Babu is the current District Collector of Kasargod. He is a PhD in agronomy from the Kerala Agricultural University. Now, prior to his posting in Kasargod, he was also holding many high-profile positions in the I.A.S. Of Kerala. In 2018, he was the Registrar of Cooperative Societies, Government of Kerala, and in 2017, the latest ones I'm referring to, CEO Additional Skill Acquisition Program. But he has received a lot of recognition both at the national level and at the state level for his remarkable work. In 2020, that's this year itself, he won the National E-Governance Award for Category 3, Excellence in District Level Initiatives in E-Governance. And he is also the winner of the first Chief Minister's Innovation Award in 2011 for the implementation of the Kerala State Land Bank. Now, obviously from whatever I have said, you will already gather that his field of specialization and research interest is land governance and good governance, and also e-governance. And all of the three, I think, especially the good governance and e-governance, he has used effectively in helping contain the COVID-19 spread in Kasargod. But I would like to begin by asking Dr. Sajith Babu, welcome to the show, Doctor. And I would like to begin by asking you, what exactly has Kerala done differently?
Good morning, all of you. In fact, what we have done differently, that then you have to see, what is there with us now. In fact, Kasaragod district, you maybe know, we were heavily dependent on Mangalore for all our medical facilities, all our medical needs. But unfortunately, due to COVID issue, our borders got closed. So literally, we were left with nothing. Nothing means we were not having anything at all. Even dialysis, almost all the medical needs, we used to depend on the Mangalore hospitals.
Correct.
So the first thing what we have done in Kasargod, I cannot say anything on Kerala because what I have done here that I can explain to you.
Right, sir.
First thing, we took a stock of the situation, what we have, and we planned based on what we had. So that is the key, I think. We have only 2 ventilators machines in Kasargod. Then our hospital staff is very, very minimum compared to the other districts in Kerala. Then the medical facilities also, we don't have a medical college over here. And only 2 recognized government hospitals, that is a district hospital and a government hospital, general hospital in Kasargod town. And we have PSCs and CHCs, FSCs and all those things. But for specialized cases like this, we cannot depend on PSCs and CHCs and FSCs. We should have had a lot of specialty hospital, but we have only 2, one general hospital and district hospital to deal with the crisis. So success, I would say, we plan like anything because we were pretty sure that if something happens in Gulf, definitely it is going to bombard on us. That was the planning we did. Because as you may be knowing, our population is 13.1 lakh as per 2011 census, and out of that 2 lakhs are in outside, non-resident Kerala. And of that, 90% are from Gulf. And from there, 90% are from a place called Dayara and Knife. So the epicenters in Gulf, where you can find the maximum number of COVID positive cases. So we were planning like, if something happens to their knife, then we'll be finished. So we were planning like that. So we kept 903 beds ready for the positive cases. Then what we have done is, another I.A.S activity what we have done is, we started telling the people that, whoever had come from Gulf or any other part of India, after February 20th, they should be in strict quarantine. I think that would be a very good strategy, because February 20th to April 14th is 55 days. So
Right.
55 days quarantine is a pretty good period for containing the virus. And we started telling the people that no, it is not home quarantine but room quarantine from March 20th onwards. So that is a pretty long period. Not home quarantine but room quarantine. We advise the people to be inside the rooms, not in houses, because so that was a very good strategy. And the social pressure we created from February 14th, that was humongous. uh, we started telling the people that no, you have to be there inside the rooms. Then we created a ward level Janajagrata Samdi, with board member, the LSG board member as the chairman of the committee. Then the Janamaitri police, that is a community policeman, then a junior health inspector, and a person, Asha worker and Asha worker. So four persons, they were gladly given a task to oversee whether these people are coming out of the houses, coming out of the rooms, and their general welfare. All those things we understood them. Then from my control room, we used to make 10% random calls to all these patients' houses, like the isolation cases houses, like we used to call 10% from my control room, like whether these committee members that they have visited them or not. Like then there were 10% random calls from the DMO's control room. Like then 90% we were ensuring that these people are working there in the field or not. Then the social pressure we created among the people through our I.A.S activities. I can quote an incident where one of the fathers of a victim, I mean not victim, I would say the positive case, he called me one day. I think that was on March 2nd, 22nd, March 22nd. After we started telling that you should be room quarantine, he called me and said, "Sir, you suddenly asked, sir, there is a problem in my house." Then I said, "What is the problem?" Then he said, "Sir, my son is tested positive, and you have advised him to go for room quarantine. He is unnecessarily missing with my wife and my other kids. So you come and arrest him." So see, a father is calling the administration saying that no, you come and arrest my son. That will never happen in the history of Kasargod or anywhere. So
Yes.
such a pressure we should build up on the people. That so that has worked a lot. Then we were the first district to start the complete district lockdown. We started doing that on March 22nd. There was a Janata curfew and declared by Honorable Prime Minister,
Yes.
and it went up to 9 p.m. in the night.
Yes.
So we introduced CRPC 144 at that time itself, because from 9 p.m. onwards we started introducing CRPC 144. So I got a lockdown from March 22nd morning itself. Then we sealed all our borders with Karnataka. 12 borders we sealed, because we had an apprehension that there will be more people coming from Mumbai side, not from Karnataka side, from Mumbai side. They can come in bikes, cars, and all those things. So they will use the small roads to Karnataka. So out of the 17 roads, we had a sitting, and we finalized that only 5 roads we can manage. So we kept 5 roads open. Then 12 minor roads we closed. So that was also a good strategy, I think. Then another thing, we started testing everything. We are the leaders in doing maximum number tests on per capita population. So per capita, our population is 13.1 lakh. We conducted more than 3,000 tests. So per capita test, I think maximum we have done in my district. We did the test for the primary, secondary, high risk. Then from 12th of April onwards, we started doing the community testing as well. Community testing. So we just wanted to ensure that there is no community spread in my district. Then within no time, we created a COVID hospital, exclusive COVID hospital. That is, we converted our general hospital into a COVID hospital, exclusive COVID hospital, and it has 212 beds. So we reduced the space, and 100 100 beds were earmarked for COVID patients, and all other patients like the pediatric, gynec, all those patients were shifted to our nearby cooperative hospital, and we gave the services of our doctors in that cooperative hospital. So that people need not, they did not come to my COVID hospital, and if they were allowed to come to my hospital, COVID hospital, then the community hospital was sure. So we took a strategy that nobody should come to the general hospital. They should go to the primary health centers, community health center, then family health center, then the private hospital. We kept the private hospital entirely out of our COVID strategy, because people otherwise, if we depend on the if you take over the private hospital, naturally there is a chance that more people will be coming to our government doctor side, and there will be pressure on our government doctors. So to reduce that, we did not depend on the private hospitals. Instead, we strengthened our government hospitals. And for dialysis thing, we have 504 dialysis patients in the district. So as of now, we would be requiring somewhere around 112 machines, but we have only less than 24. So what we have done is we started strengthening our community health centers, and within 2 months, there will be a situation like not even a single person will go to Mangalore for doing the dialysis. So we have done all the things. So likewise, we created the system now.
That might be a little unfortunate that COVID blocked the relationships between Kasargod and Bangalore, because they have been always very close.
I won't say like that. Because still we have a very good tie up with Bangalore, because see, the NH connects all the states. So once it comes from Karnataka, you cannot say it is cut. There is a lifeline.
Yes. This 903 beds you mentioned, you prepared 903 beds because of the population is 90% in the Gulf and all that stuff you told me. But 903 beds, how did you arrive at that figure? On what basis?
Because general hospital we had, in fact 212 beds we have, but we reduced it to 100 because COVID-19 patients require 1.5 meters social distancing and all those things like that. Not 100 beds we created. Then district hospital we have nearly 70 beds or something. Then there were 2 abandoned hospitals which were not functional. We took over that. And we furnished it. And like there is a hospital in Patanakad. It was closed for many years. So we cleaned it up. Then now we have admissions over there. Then there is a Care and Cure hospital which was also closed up. We furnished it. Within no time, we furnished it and we started it. So you may be knowing, when our Honorable Chief Minister said, that medical college should be ready in 4 days. We made it ready in 3 days. So, like this, the entire missionary was after it. Then what we have done is, we created that medical college. There we have 300 beds. 300 beds medical college. We made it during this time. 300 bed. Then Central University hostels we took over. There we got 300 beds. Then another ladies hostel which was about to be inaugurated, a brand new one, where we created 120 beds. Like that, 903 beds we were ready, but we were pretty sure that it won't cross 300.
Okay.
But fortunately, it became only 171.
Yeah. So what's the current status, sir? Current status?
We have only 27 patients now with us, and they are very, very healthy. No problems at all. And most important thing is, not even a single mortality in my district.
Yeah. I just wanted to ask you. I read an article. I'm not sure whether it's. You should be able to tell me. In the Week magazine, I read an article about this police strategy or district strategy of Lock 1, Lock 2, and Lock 3. Have you seen that? Have you seen that article?
No, I haven't seen. But the containment we started from March 22nd morning itself.
I want to ask 2 specific questions. One is, how did you manage the contact tracing? And number 2, in Lock 2 is geophysical tagging. How is that working? I just want to know these 2 things out of that.
Actually, what we have done is contact tracing. We have a special team for doing that. One of my district surveillance officer is Dr. Manoj, and his team has been fantastic. What they have done, because we have an advantage, like people who are tested positive, most of them, maybe 90% of them, they came directly from the airport to their house. So that was first thing. Then they got mixed up only within their family. They did not go out because now the pressure we brought in like no February 20th, that particular cutoff date. Nobody they ventured outside. And what we have another two more statements we did during that time. Because whoever breaches the government directives, they will never see Gulf again. So that I made a public statement like that. I think that was a very good strategy because nobody ventured out. And then we kept nearly 380 lodge rooms ready for these people who are violating the law. So, but I could not use the entire thing. But 48 beds we used. And the thing is that Kasargod is not such a big town, so the rooms which we arranged were a bit filthy, and with a lot of mosquitoes, a lot of bugs, and all those things. So 48 people who were brought into those containment rooms, they gave a clear message that it is tough times if you breach in the direction of the government. I think that has also worked a lot. Then lockdown things, what we have done is the police first they earmarked. We had only 7 zones. All these things happened only in 16 panchayats and 2 municipalities. And I have 38 panchayats and 3 municipalities. One municipality was completely free. Then my nearly 21 gram panchayats are completely free. So we had a strategy like that should be a zonation. Zonation like this should be separated out. Otherwise it will spread to my other regions as well. So we have a core committee meeting with the police and all. There we made a strategy that it should be cordoned off. Where these things are there, it should be cordoned off. And where it is inside the cordoned area, the police will supply all the medicines, food, all those things. Mm-hmm. Then through the GPS tracking, we could find out the persons who are coming out. And we started filing cases against those persons. So that has worked. Again, we have a manual mechanism as well. The Janajagrata Samiti was very active in the field, and the people, my goodness, hats off to them. If somebody ventures out, then on the same spot we used to get calls. Be it his close relative, son, mother, or whoever. If somebody ventures out, we used to get called from the same house even. So that was fantastic.
In fact, I'm not sure whether you have read, there was an author earlier, Alistair MacLean. When I was a kid, he used to write. And one of his most famous book is called Fear is the Key.
No.
Fear is the key.
Yeah. I think fortunately or unfortunately, we had a day on which there were 32 cases positive. So I think it was on 27th March. So it was highly frightening. It was highly frightening for everyone, even for the officers like us.
Yeah, and one last question I'd like to ask you, sir. Treatment, once, let's say they are positive and they are admitted to hospital, then is there some treatment protocol, or with what are they being treated? How are they being treated? What's the scene like?
I would say, another most important thing what we have done is, we get an information that somebody has come from outside. We get an information. So what we do is, we tell our local level team to visit that particular person and check for his general health, whether he's having any of the 4 symptoms like the sore throat, runny nose, a fever, like that. There are 4 typical symptoms for COVID. They simply go to that house and see whether that person is symptomatic or not. Then if any of the symptoms are there, then directly from there, they call our control room. From the control room, we intimate that person, we call that person, because we have the phone numbers, everyone who are returned from Gulf or other countries and contact, everything we have. So we make a call, get ready, our ambulance is coming. Then we send our ambulance. We send our ambulance to that particular person, we take him to the GH or DH, then we take the swab, and we won't allow that person to go back. We will keep him in isolation, in our own setup. Then once his result comes as negative 2 times, then only he will be released. Otherwise, he'll be in government custody.
Okay.
Then, if that particular person is tested positive, who is in isolation with us, then we won't allow that person to continue in the lodge. We'll take him to the hospital. Then general hospital or district hospital and the other hospital, I said, government hospitals only. We keep them there. Then continuously, we'll be giving the food. It is prescribed for the patients because we have a diet. Yeah, then he'll be shifted to hospital. And we have a dietitian who prescribed what should be the food for this the COVID-19 patients. Then whatever he prescribed, we were supplying the food. Then to make them relaxed, because virus basically you have to see that the person is happy. If the person is happy, naturally the tendency for viruses to die, it is more. That is what we read from the literature. So we gave mobile phones. We allowed mobile phones everywhere. We gave them, most of them have smartphones. So with the smartphones, they used to have video chat with their family members, spouse contacts, and all those people. Then they used to WhatsApp, they used to Facebook, do the Facebook Live. Like that, we allowed them to use the mobile phones. They were quite happy. We ensured that they are happy there. I think then with the medicines and good treatment, everyone got cured.
Yeah. And that's a very nice thing to hear. And I think as we come out of what are the plans for the lockdown? How long you're going to plan it? How long do you plan to hold on to it?
And actually, thing is that we have not won the war so far because we have 27 more patients with us.
Yeah.
They should all be discharged, first thing. Then for the continuous 14 days, we should get all negative. There should not be even a single positive case. So then only we can say we are safe.
Correct.
So we are not relaxing. We are not relaxing anything.
Okay. Yeah, I know.
Tight only.
It's a long, drawn out affair, this COVID thing. But I do believe that this week the UK, Oxford University will be starting human trials of a vaccine. And there are one or two positive signs even coming from Israel. So I think Indian virologists are also working on something. So possibly by another 2-3 months, we might be having something positive. I thank you, sir, for joining us. It's been a wonderful experience talking to you. And I'm sure we have all learned something from that. And every day is a new learning. So yes, perhaps whatever we learned, we will try to implement whenever we can. Thank you very much for joining me, sir. Thank you very much.
Thank you all. Thank you.